Javier Farje is a Latin American analyst. He's also a Peruvian, and he joins us now from London. Javier, welcome to the program. What explanation is there for Peru having the highest per capita death rate from COVID-19 in the world? Have people not been following regulations? Have there not been rules in place?
That's two of the reasons why the situation has got much worse. When the pandemic started around March last year, the government of then President Vizcarra, who was deposed by Congress later, established a very hard, rigid rules, which included a curfew supervised by the army that was relaxed. And most of the deaths happened in Lima, like the capital of Peru. 46% of all the deaths come from Lima, because Lima is a very crowded city where social distancing is very, very difficult to achieve because people live very close by. Many people do not have the facilities to keep food in their homes. Therefore, they have to do regular trips to markets or open markets or supermarkets, which means that social distancing is not working. And there have been many violations of the lockdown, which the police they don't have the resources and the capacity, to stop. On the other hand, as you said clearly in your report, these are not new deaths. These are deaths that already occurred that doctors knew had actually happened, but they were not reported. Many people, many institutions did not report death of COVID-19 as death of COVID-19. So the problem is, and also there's another reason, the health system in Peru is totally, it was bad before, it's collapsing now. I know personally people close to me who died because they couldn't get a bed in an intensive care unit. And we are talking about care unit and talking about middle-class people. We're not talking about poor people who live in the shanty towns who are even worse off, but middle-class people who couldn't afford oxygen or couldn't afford to have a bed in a hospital. And, and we're talking about full households being infected, like father, mother, son, and daughter. In this particular case, I'm mentioning you. This person, the father died because of that situation. So we're talking about also there's a level of negligence from the government in terms of providing oxygen. Many people, as what that witness declared and stated in your report, said, we are not told the truth, but also we don't have the facilities to get oxygen. There are harrowing scenes, harrowing stories in Peru of people selling their houses, selling in the countryside, selling the animals so they can have one oxygen a bottle of oxygen, and sometimes that's not enough. There are many factors and many elements which contributed to this, but one of them is precisely because many people have also violated the rule. Many people need to survive. Many people are street vendors, people who belong to what they call the informal economy. In this informal economy, there's no social distancing because they have to work very close by. And as I said to you, the crowded city in Peru is Lima, the capital, and that's why 46% of people who died, especially people over 60s, come from the capital of Peru. The other cities have fewer sort of deaths. So these are all the elements, and probably more, which can explain why Peru has become the worst per capita. We're talking about 5,400 deaths per million people, which is an extremely high figure.
Javier, you mentioned shanty towns. They're not uncommon across Latin America. I mean, during the course of the pandemic, we've heard so many horror stories across the continent, dead bodies in the streets in Bolivia. We know what's happening in Brazil, the Copa America football tournament just being taken away because of a rise in cases in Argentina. Would you suspect that across Latin America, the numbers are being underreported?
Yes, definitely they have been underreported because it's very difficult to have access to information in shanty towns. Shanty towns are no-go areas, and officials from health ministries or the government do not go there. So we have many unregistered deaths. Also, we must not forget this, the Amazon. The Amazon is a big problem. Many indigenous people have been suffering of COVID. You have a member of a community who goes from their community in the remote part of the Amazon to the city to sell the produce. That person goes back with the virus. He infects the whole community, and that community doesn't have access to, for example, health service. And of course, least of all, information about how many people died. So you have the element of lack of access in remote areas of Latin America. The Amazon covers a big chunk of South America, as you know, and those are unregistered deaths, but also many people who do not have access to health service. But also the shantytowns, you go to Caracas, you go to Lima, and you see the shantytowns, they're crowded people, hills around the big capitals, where people live in such terrible conditions, hygienic conditions. There's no access to water, to basic facilities, and makes the situation even worse. And because medical authorities, because paramedics, because government do not go there because there are no-go areas, then the situation is even worse than in the big cities or in the big sort of urban areas.
Javier, we always appreciate your appearance on the News Hour. Thanks so much indeed. Javier Farje speaking to us from London.